Heartland Cares Incorporated has blazed a trail of success in its mission to provide comprehensive, client-centered, quality HIV/AIDS health care and support to those in need, regardless of their ability to pay.
Heartland Cares is the HIV medical clinic and social service agency that serves Western Kentucky and Southern Illinois. The patients that come to us, really, we're their only access point for specialty care for their HIV infection in hundreds of miles. And that's what makes the existence of Heartland Cares so critical. Many of our patients not only need HIV specialty care by our infectious disease doctors, but we provide primary medical care for probably 75 to 80%. And in addition to that, some of those patients need assistance accessing their HIV medications, which are very expensive.
Hello. Hi there. I went in the hospital here in Paducah with spinal meningitis, and which that was very fatal, could have been. And through all my blood work and tests had been done, on my birthday, I found out I was HIV positive. So I sat at home and I dwelled on, I'm gonna die, because that's all I knew was what I'd seen on TV. Born and raised not far from here, but I came here for long-term care, met some wonderful people who cared about my well-being. I came here, I was introduced to my doctor, and the staff was just so great, and saying, we can beat this.
People with HIV and AIDS still face a degree of stigma. They still face a degree of, discrimination, for lack of a better word. They can't just go to their doctor as comfortably as most of us can for other medical problems.
When I first came here, I was scared to death. It was the turning point of the whole clinic, all the staff here at the clinic saying, we are here for you. They really cared about me and my well-being.
Heartland Cares recognizes that the problem of HIV/AIDS cannot be solved by only treating those already affected. This is why they have not only devoted their actions to treatment, but also to awareness and prevention.
Within the specialty infectious diseases, a lot of times you're seeing people with a problem and you get the problem fixed and then you deal with somebody else. The nice part about HIV/AIDS care for me is that it allows me the opportunity to provide continuity for people over many years. So it's the one portion of infectious diseases that allows me to get kind of an ongoing patient-physician relationship over a more extended period of time. Folks with HIV have come to this clinic. They recognize that they can get a variety of services here, whether it's physician care, whether it's case management services, whether it's nutrition services, dental services, excellent nursing care. So they develop a level of trust with the clinic and the providers here at this clinic. And as a part of that, they develop, I think, a unique trust with their physician providers.
When we get a new patient that arrives to us, what we do is we sit down with the patient, and our first goal is to make the patient comfortable and feel at ease, feel at home, if you will, and feel that we are there to help them and we're not judgmental by any means. We sit down with the client and we do a detailed psychosocial history. That history enables us to formulate a plan of care that best helps that client enter the mainstream healthcare society and get the services that they are in need of.
As the recipient of the Fifth Third Bank Innovative Nonprofit Award, Heartland Care's insistence of a team approach to streamlining care has been recognized for its profound impact on the community. Partnering with organizations throughout the region, Heartland Cares has extended its caring reach into rural communities otherwise isolated from quality HIV/AIDS treatment and counseling.
For some period of time, we were trying to serve all of our patients out of our main clinic in Paducah, and we realized that the burden for them in terms of transportation costs and time away from work or caring for their families was huge. And so then we started thinking about how can we take that care closer to them, closer to where they live. So we started developing partnerships that would allow us to do that.
We have to develop partnerships with the health departments in these areas. We have to develop some relationships with the physician and social service providers in these areas.
I think what makes Heartland Cares innovative is what we've called for years a one-stop shop approach. But that's what we do. We try to make sure that all of our patients' medical needs are taken care of and coordinated through this facility.
There's a number of different services under one roof. And so there's a variety of services involving case management and housing and outreach services and you name it.
We have a multidisciplinary approach to patient care. We provide HIV specialty care, but we also provide primary care for a large percentage of our patients. We can't only worry about what we're doing today, we have to constantly be assessing the environment, particularly as it applies to the delivery of health care in America today, and figure out how are we going to do it better? Can we do it differently so that we can be more effective for our patients?
Heartland Cares, winner of the Fifth Third Bank Innovative Nonprofit Award, providing HIV/AIDS care, prevention, and community awareness.